Thanks for taking the time to listen to the Phase 2 summary of our PodD and QuickTrack improvement work. This phase is going to focus on the way that we utilize Medix in our intake and PodD area. So as you all remember, the change that we made recently was eliminating the distinction between QuickTrack and PodD patients. So all ESI vertical 3 through 5 patients have been seen in the order of longest wait time by the available intake providers. We also moved the intake rooms up to the TR1, TR2, and TR3 spaces. And to facilitate that elimination of distinction between QuickTrack and D patients, we updated the guidelines that were created to facilitate what patients go through our intake model and those patients that should go through our higher acuity space in pods A, C, and E. So this focus of the next round of changes is really on the role of the paramedics in the intake room. So the biggest things that you'll notice starting on Thursday of this week, September 27th, will be that the PodD medics are no longer assigned to a specific provider and based in the intake rooms. We will have each medic with a specific different responsibility, as you can see in the table here. So the intake medic responsibility is going to be for loading all intake rooms with a patient so that all providers are ready to see patients throughout their day. That medic is also going to be responsible for completing required screening, documentation, and med reconciliation information, provide support to the intake provider for exams or other procedures that may be done in the room still, and then facilitating movement of patients from the intake room to the next treatment space or to discharge if that's the next location that they'll be moving. This role will not be responsible performing lines and lab draws. We'll be utilizing the medics that'll be assigned in the other two spaces to do that work. And if there isn't an active need to move a patient into a room to assist with a treatment or a procedure or to discharge a patient, the intake medic is going to position themselves in the hallway alcove that's between the intake room and Pod D, and will utilize a WOW as their computer location. The results waiting medic is going to be located in Pod D, but in D1 and D2, which are currently set up as results waiting spaces. That medic is going to own care for those patients in D1 and D2, which includes performing any type of laboratory draw that needs to happen, placing IVs, doing any medication administration that's an option for medics currently within their scope, and then really serving as a supporting team member if the rooming and intake medic is not able to keep up with the demand for rooming or doing work within the treatment rooms. The Pod D treatment medic is going to locate themselves in the Pod D treatment space. They will not carry a room assignment, but will provide support and treatment to patients in conjunction with the Pod D nurses. This role also will be expected to flex and provide support in Pod D, meaning in the intake area or in the results waiting space if needed, and really making sure that patient care progresses appropriately, both in Pod D, but if not needed there, primarily we'll also support in the other areas that we have medics assigned. So the testing plan is to begin on Thursday of this week, September 27th. It will run for 4 weeks. And we'll be monitoring patient flow and feedback from staff during this 4-week time period. Our measures of success are really going to remain around our length of stay measures that we've seen improvement around as we've joined the QuickTrack and Pod D populations together. And a lot of the information that we'll use to judge success of the trial will also be based on verbal feedback from staff as well as the paramedic team to understand about their view of the role and if it's more fulfilling than the role of the intake medic in the intake space tied to one provider. So with that, I'll close. This is just a little update for everybody to be aware of, and you'll see more communication via email and in huddles that will begin on Tuesday of this week and continue throughout the week and into the weeks that follow, similar to the communication plan we use for the initial phase 1 worth of work.